Yangcheon-gu is named to signify the harmonious coexistence of light and stream water. Since its establishment in 1988, it has evolved into a central city of Seoul where residential, commercial, and business functions harmoniously coexist. It is located southwest of Seoul, comprising 18 administrative zones, with a population of 440,000 and an autonomous district in Seoul with a large population of children under the age of 18, and is a leading educational city in Korea. Now, the status of maternal and child health indicators in our country. Korea's birth rate has decreased to a quarter of what it was 50 years ago, and the total fertility rate has dropped to 1/5. Compared to the average national birth rate of OECD member countries, Korea has the lowest fertility rate. The infant mortality rate is 2.4 per 1,000 live births, lower than the OECD average of 4.1. The maternal mortality ratio is 8.8, lower than the OECD average of 11. Korea has implemented a national health insurance system. Citizens can receive high-quality medical services with minimal out-of-pocket expenses, resulting in high accessibility to medical services. Koreans visit doctors an average of 15.7 times annually, the highest among OECD countries, approximately 2.6 times the OECD average. Next, we will explain the country, Seoul, and major maternal and child health policies. In response to the announced policies addressing 5 areas to overcome the country's low birth rate, the government has emphasized reducing child rearing costs and enhancing the maternal and child health policy. The government's initiative includes eliminating out-of-pocket expenses for inpatient treatment for children under 2, supporting testing and treatment costs for infertility, and promoting pre-pregnancy health management. In July 2022, Seoul launched the Parents' Happiness Project. The city mayor stated, "We are making a new investment of approximately $1.43 billion in 28 policies across 4 main areas. Over the next 5 years, we plan to invest about $10.93 billion. Next is about major maternal and child health policies, including those of the Seoul Metropolitan Government. Maternal health and prenatal care fall under this category. Medical expenses are covered by health insurance, with expectant mothers bearing only 10% of the costs. The budget for the national initiative is primarily shared between the federal government 30% and local governments 70%. National projects include cash support of up to 1 million won per person through voucher cards, and health services such as registration and management of pregnant women, birth environment, and postpartum care center supervision. Next is the field of children's health care. From 2024, the government plans to reduce the out-of-pocket hospitalization expenses for children under 2 from 5% to 0%. This is a project to support infertility treatment costs and checkups. In 2022, 9.3% or 23,000 births were born with support for infertility treatment costs. The national policy covers 70% of infertility treatment costs under federal health insurance to alleviate the increasing burden of infertility treatment costs. Seoul City also provides support for out-of-pocket expenses incurred during infertility treatments. As of July 2023, the policy expanded to cover all beneficiaries, abolishing the previous income-based restrictions. Korea has a cultural practice that supports the physical and mental recovery of mothers for 3 to 4 weeks following childbirth. Postpartum care services can be broadly divided into 2 categories. One where the mother enters a postpartum care facility directly from the hospital and receives 24-hour care for both the mother and the baby, and another where a trained health manager visits the home to provide postpartum care. As of 2022, 81.2% of all newborns utilized postpartum care centers, with an average cost of $3,114 for 2 weeks. The national government provides up to $1,476 in childbirth-related expenses through a voucher card. The city of Seoul is implementing an additional postpartum care expense support in September 2023, providing up to $738 per person to Seoul citizens. Policies implemented by Seoul City: postnatal examination and examination fees, postpartum care expenses, child care fees, transportation costs for mothers, and traditional Korean medicine infertility treatment support. Income-based support policies include Seoul-style household support and incentives for parental leave in Seoul. Visit-based services include the Seoul Healthy First Step program with nurses, the Happy Breastfeeding program with breastfeeding experts, and the Mom's Book Support program offering parenting book desks. The Seoul Healthy First Step project, SHFSB, was initiated in 2013 to support women with infants and enhance the baby's health and development, ultimately aiming to close the child development gap. Since 2014, 6,123 individuals have been registered in the Yangcheon district for the Seoul Healthy First Step program, with currently about 590 mothers being managed. A specialized infant health nurse visits the mother's home, inspecting the baby's health from head to toe and ensuring proper growth and development. The nurse checks if the baby's environment is suitable and provides necessary guidance on child care. The nurse offers advice on the baby's sleep, safety, and development, teaches how to care for the baby.
을 안 가가지고 얘를 진짜 신생아 때부터 혼자 봤었는데 뭐 기저귀 가는 거나 모유 수유하는 거나 이런 거 모르는 거 있을 때 일단 물어볼 수 있는 사람이 있다는 거에 대해서 되게 든든했어요.
이것저것 정보도 많이 주시고 동네 친구들도 만들어 주셔서 아기 엄마들이랑 이제 모임도 갖게 되고 정보도 공유하게 됐어요.
The following is the operational framework of Yangcheon-gu Health Center's maternal health policy. The mother and child health team is driving initiatives across 5 sectors: prenatal health management, child health management, creating a safe pregnancy and childbirth environment, medical expense support, and vaccinations. And 3 offices within the health center: the vaccination office, the maternal office, and the medical expense support office. It's a model for nationwide mother and child health policies, worthy of being selected as one of the 3 best practices by the Child Policy Research Institute, a Ministry of Health and Welfare research institution. A unique infrastructure found only in Yangcheon District is the Mother and Child Health Center and the I1 Center. The Mother and Child Health Center features services like Mom's Clinic, Pregnancy Support Counseling Office, Education Program Rooms, Nutrition and Psychological Counseling Office, and a community space. I1 Center is a child health management institution that continuously manages high-risk children through health checkups as well as health experience activities for general children. The I1 Center has seen around 2,000 visitors annually. In the district, 15% of children aged 5 to 7 visit for health experiences.
Now, introduce the various programs of the Maternal and Child Health Promotion Center. Childbirth Preparation Class. That teaches methods of childbirth, newborn care, and breastfeeding. Sensory Play Class. Baby Massage. Mom and a Companion, a 6-week project to improve your own mental and physical health habits. We provide health kits and provide ongoing management using social media. There is also a psychological counseling program for pregnant women and mothers, sewing for the prenatal, and online classes that run at night for new moms and dads. Breastfeeding clinics are conducted online as individual consultations. We also provide special lectures for mothers and safety training for emergency situations. Next is the I1 Center program. We teach you correct health habits through 7 experiences are available for individuals and groups. We screen children with diabetes, obesity, and ADHD through age-appropriate health checkups and provide ongoing management for children with health problems. We operate the Health Plus program during summer and winter vacation periods. This program consists of body composition testing, health habit management, exercise, and nutrition education.
Yangcheon-gu is dedicated to promoting maternal and child health, striving to be a city that focuses on childbirth and child care. With this, I will conclude the introduction to South Korea's maternal health policy initiatives and Yangcheon-gu's Maternal Health Promotion Center. Thank you for your time and attention.